Hello everyone, I hope you all are doing very well. And here in this session, we are going to discuss one of the important evaluation metrics, that is specificity. Basically, we can put this metrics into the binary classification models evaluation, and mostly it is used in medical diagnostics or disease screening. Basically, it is going to measure the proportion of actual negatives or the known events that is predicted correctly. That is, if any specific person does not have disease and your model is also saying that it doesn't have disease, so it is correctly predicted that that person doesn't have any kind of disease. That is actual negative cases proportion, right? So we can take one example, and with the help of that example we can learn it more. Consider a medical test designed to detect certain disease, and the test results are binary, that is positive indicating that presence of disease and negative indicating that absence of disease. So let's say we have following outcomes. So true positive, 90 patients are true positive that actually have the disease, and false positives are 20 patient test positive but don't have disease actually. And true negative are 120, means patients are going to be tested negatively and patient doesn't have any kind of disease. And false negative means 30 patient test negative, but actually they test negative, means they don't have disease, but actually they have certain kind of disease. So this is false negative. So what specificity say that what are the true negatives proportion in true negative plus false positive, right? So how many tested uh, true negative out of true negative plus false positive, right? So false positives are which is considered as a positive but actually have disease. So we are going to calculate this specificity evaluation metrics, right? So true positive here, true negative in this case are 120. It means that 120 persons don't have disease, and the model is also predicting that that doesn't have any disease. So this is correctly predicted that persons are, you can say that persons are okay, they don't have disease. But we are going to calculate its ratio with true negative plus false positive. False positives are 20. False positives means what? Here you can say that false positives. So 20 patient test positive, but they don't have disease. Means even though they don't have disease, model is predicting that they have disease. So the treatment can be very much critical on their health, right or not? So 120 divided by 140, it would be like 0.8571. So the specificity is 0.8571. That is the ratio of true negative divided by true negative plus false positive. So specificity of medical test is approximately 0.8571 or 85.71%. So what it interpret? It interprets that the correct, the model in the terms of true negative, or the model is 85.75% specific on the term true negative. Means if person is healthy, then this model is going to predict 85 times that that person is healthy, right? So some real world applications of the specificity where we can use this metrics in medical diagnosis, disease screening, quality assurance in manufacturing, let how many bulbs are actually working and not working, like that, or fraud detection in legitimate transactions and non-legitimate transaction, in mental monitoring, like which are pollutants and which are not pollutants, and like that, right? Okay. So the importance is minimizing false positive. The importance of specificity metric is that high specificity means that the rate of false positives are very low, and the term specificity is going to considered when we are going to reduce the false alarms, so that the person who is already healthy do not require any medical treatment, and it might be critical on their health, right? So we need to reduce the false positive cases. So this is one of the most important specificity cases. And one of the important one is evaluating test reliability, that if any particular diagnosis center is doing the test, what is the reliability? So 85% reliability in the true positive rate, that is the true positive rate, right? So such kind of comprehensive assessment of a diagnosis test can be evaluated, or such kind of model can be evaluated on the specificity metrics, right? So the summary, we can conclude it that specificity is a valuable metric in evaluating the accuracy and reliability of binary classification models particularly in applications where correctly identifying negative cases is very critical, right? And it plays a significant role in fields like healthcare, manufacturing, finance, and environmental monitoring, right? So I hope that this session is going to be helpful for your knowledge building purpose. Please stay tuned and subscribe for more such important informative sessions.